Hi, this is Dr. Doug Kennedy. I'm practicing in Boulder, Colorado as a chiropractor and a certified acupuncturist. These slides and pictures I'm going to be talking to you from are thanks to the Spine Research Institute of San Diego. I took some seminars with them some years back and ordered these beautiful posters that I've been using to educate patients, and I thought I'd share them with the rest of you. So today we're going to talk about facts about whiplash injuries, and there's quite a bit of myth and fact that we need to discuss. So over on the left hand side here are some myths, and you can read them for yourself, but for those of you that are getting an audio feed or a podcast, I'll read them to you. Common myths about whiplash. Myth 1. A low-speed rear impact crash probably won't cause injuries. That's not true. Another myth is that these injuries that are caused in accidents can heal in 6 to 12 weeks. Also not necessarily true. Some people believe that litigation, meaning that the person driving the car that was injured, has picked out a lawyer and wants to go after a lot of money. So some people think that litigation has an effect on the patient's recovery. Not true. In my personal experience, being a chiropractor for 22 years, I found that most people simply want to get back to the way they were. They don't really want to get lawyers involved. And the only reason they do is that they need to make sure that their bills are paid and that they have some money to cover all the time and energy that it took for them to go through this process. Another myth is that the patient's pre-injury psychological makeup can affect their recovery. Well, it's true that anybody that's got a lot of psychological problems is going to be harder to deal with no matter what's going on. Any doctor will tell you that's true. But in my case, once again, most people just want to get better. Another myth is that greater vehicle damage would cause or be equal to greater occupant injury. That's not necessarily true. And the last myth is that an accident reconstructionist can predict injury potential. There's quite a bit of science that's developing, and it's getting better all the time. But some of these engineers who are brought in as expert witnesses and accident reconstructionists would like to tell you that based on the measurements of the skid marks and how far the cars slid and whether they twisted or not and what car materials make up the car, these sorts of things, that they can tell you the person inside should have been damaged or injured or not. And that's not necessarily true. There's just too many variables in these things, and everybody comes into it with their own physiology. Some people play football and have thick necks, and some people are ballet dancers and have long, slender necks. Okay, let's talk about some crash facts. Most injuries occur at crash speeds below 12 miles an hour. That's a fact. Most cars withstand an 8 or 12 mile an hour impact without any structural damage. Again, another fact. More than half of all of these low-speed rear-end crashes occur without vehicle damage. And there is no correlation between the damage and the outcome to the person inside the car. Another fact is that your head will accelerate much faster than your vehicle, and that even a small crash at 5 miles an hour can cause 10 to 12 G-forces of acceleration to your head. Now there's a graph here that I want to show you, and this is basically the speed over here, 12 miles an hour being up here, 0 miles an hour down here. This red zone is where most of the injuries occur. This is where a vehicle will have the beginning of vehicle damage will occur, somewhere in this range, 8 to 12 miles an hour. But what about down here? This is the people that I see all the time. These are people that are in very low, 10 mile an hour, 20 mile an hour car crashes. The science now shows that if you're a healthy volunteer and you're hit at 5 miles an hour, you can be injured. Okay, now there's another set of variables that we call risk factors, and quite quickly, if you have any of the following going on at the time you're hit from the rear, you're at higher risk for being hurt. If you're female, or you're caught unaware, or if you have your head turned, a prior injury, prior headaches, prior neck pain, poor head restraints, poor position in the car, arthritis, advanced age, some disc disease in your neck, if you have a shoulder harness on, if the car is hit from the rear, and if your seat does not absorb the impact. It's called non-failure of the seat. Most modern car seats are designed to withstand accidents and to absorb some of the forces before it gets transmitted to the occupant sitting in the seat. However, older cars do not do this, and they basically act like a very rigid material that forces into you. When your car is hit, you feel it almost the same as if it was hitting you. Now, with these types of risk factors, with these type of risk factors, you can usually get hurt below 5 miles an hour. And if you have a few of these risk factors, which many of us do, you can get hurt being hit at 3 miles an hour. So these are some of the common myths and facts that are involved with whiplash injuries. And I'm very happy to say that there's a lot more known now. We're going to move on to some of that in the next video. I hope you join me again. Once again, my name is Douglas Kennedy. I'm a chiropractic physician in Boulder, Colorado. I also work as a certified acupuncturist, and I have a very professional clinic. We don't try to set people up on big treatment plans. We try to get them in and get them out. We also refer people out right away if they need it, and I have excellent referrals within the medical community of Boulder, and am more than happy to talk to anybody that has a need for our services. Feel free to call the office at the number below, or check our website and look for more videos to learn more. Thanks for joining me. See you next time.